Joan Ryan Estee with Enlaces on the State of Alaska.
Matthew Hurt, Legislative Counsel to the Assembly.
Jasmine Akers, Deputy Clerk and staff to the committee. Lori Pickett, Alaska Literacy Program.
Great, let's go through those online. I'll just go down the list. Well, I can see Mara. Go ahead, Mara.
Hi, Mara Kimmel.
Welcome. And Issa?
Hi, everyone. Issa, State Refugee Coordinator.
Great. And then we have 907-727-0805.
That's Mark Littlefield.
Great, welcome. And then I see another phone number coming in. Mark, if you wouldn't mind just renaming yourself so we have your name, that'd be great. And then I see 907-903-7306. Do you want to introduce yourself?
Hi, this is Carmen Paredes with Enlaces. Sorry, I was hoping I could be there in person, but I had a family emergency, so still at the doctor, but I'm here.
Okay, great. Glad you're here. Did you say Carmen?
Yes, Carmen Paredes.
Great.
Yes.
Oh, excellent. Great. If you can I don't know if you can, but if you can rename yourself on Zoom, or sorry, on Teams, so we can have your name handy, that'd be great.
Yeah,
Okay,
so
and
in my
go ahead.
phone, I cannot do it, but as soon as I get home and I log in from the computer, I will do that.
Okay, no worries. And Asher.
Hey, this is Asher Harley here representing a congregation Beth Shalom.
Great. Here yet? Nope. Okay. Land and labor acknowledgement. Is there someone who would like to volunteer today?
Well, I'll go ahead and read the
Okay,
one that we
great.
have, the one that we have here. We acknowledge that the land that now makes up the United States of America was the traditional home, hunting ground, trade exchange point, and migration route of more than 574 American Indian and Alaska Native federally recognized tribes and many more tribal nations that are not federally recognized or no longer exist. We recognize the cruel legacy of slavery and colonialism in our nation and acknowledge the people whose labor was exploited for generations to help establish the economy of the United States. We honor indigenous, enslaved, and immigrant peoples' resilience, labor, and stewardship of the land, and commit to creating a future founded on respect, justice, and inclusion for all people as we work to heal the deepest generational wounds.
Thank you, Pastor May. Okay, let's go first to unfinished business. Before we begin, we had a request just before the meeting began to add the language access audit that we received by email to the agenda. Is there any objection to adding that under unfinished business? Okay, hearing none, we'll add that. And just while I'm at it, are there any other agenda items that people would like to add today? Okay, hearing none, we'll just go forward. The Change Lab legal analysis, we're still tabling that because I think it depends a bit on our discussion today about our priorities, whether we want to come back to that. So we'll just proceed with tabling that one. Let's discuss the language access audit. Joan, do you want to start us off?
Yeah, sure. I read the audit that like 5 minutes after Jasmine sent it, and in my opinion, I thought it was very in depth, and I think that we can do a lot of progress. I'm just curious if anyone knows who's the liaison that is mentioned in the audit. That's my only question right now.
Felix isn't online tonight. So I don't know, Jasmine, do you have any information on that?
To the chair, I do not know.
Okay. let's mark that down to find out. For those of us who haven't read it, can you just give us a little bit of your perspective on what it shares and anything that we might want to work on further?
Yeah, so the audit, so the person or the team who did the audit, they went to different departments and just asked about the translation services that they have, the interpretation services as well. They found a bunch of flaws, but also what it was really good to see was that the mayor's office was engaging with the audit and said that they're willing to participate and apply different recommendations that they made in the audit. And that was really nice to see. I'm really hopeful that this actually happens. So yeah, there's not very many. There are departments that have nothing on language access, and there are other departments that they do have some stuff on language access, that being translations, translated material, translation over the phone, etc. Lori, do you remember anything else? I know there's way more in there.
I commend those who worked on it. I mean, they detailed out that even the link to report, if you could not get language access, did not work. The link itself was broken. That many departments do not have language access plans, and if they do, their staff is not trained. They acknowledged that. They acknowledged that the frontline staff did not know how to access Language Link. The one department that was using Language Link at all was the health department, which I thought was interesting to note. And I can say that I know that a few years ago, ALP did a lot of work with the health department on how that works, and our peer leader navigators worked with them and they committed to that. So it looks like maybe some of that held. So I think that when they acknowledged training was key, that's really, really important. But it is very telling and clear that language access is not consistently and legally provided by the municipality. And so acknowledging that is the first step in being able to move forward with making some changes. So I really recommend everybody read it. I know that there's just a few of us that are as crazy passionate about language access, but I really think that it's worth reading.
Yeah, it's an easy read too.
It's an easy read, yeah. And if you go to Alaska Literacy Program's website, we have a really good public language access plan, why it's important, resources on how to build plans. And so if people are just more curious, I think that that's a decent way to start. But I can say that with trying to access services in the municipality, people are told to bring their own interpreters on a regular basis. And I think that was acknowledged.
I just was pulling the report up and just with the question of who is the language access liaison. It says, according to the Office of the Mayor, after the creation of the Chief Equity Officer position, an unwritten policy placed the responsibility for language access in the Chief Equity position. However, we were told it was the intent of the Mayor's office to resume this responsibility. Office of the Mayor appointed a staff member to be the Mayor's language access liaison, a position that had previously been delegated to the municipality's Office of Equal Opportunity. So it never names who it is. Okay, so there's some staff member. Okay.
And what department do they work in?
In the mayor's office, it says.
In the mayor.
Yeah.
Okay.
So
Mara
wait.
has had her hand
Sorry.
up.
Sorry about that. Go ahead, Mary.
That's okay. Thanks. And thanks for circulating the report. And I glanced at it. And I think as was pointed out already, there's a lot of work to be done. I'm also curious, I didn't see a place where talked about the police department and whether they were part of the audit. And I'm curious if APD does their own, or what is the language access accountability in that department? Does anybody know?
I can just share that Felix said that he'll hop on in a few minutes. He's at the airport, but he'll be here to respond to questions.
Are there any other questions or follow-ups in terms of things that people read in the recommendations that they want the committee to kind of keep an eye on, or because we can try and get answers to the questions we've come up with.
Can
Yeah,
oh, go ahead.
Good. No, I was just gonna say, I didn't have any questions or follow-up or anything, but considering the importance of language access to many on the committee and just in general, I'm glad that we got an audit report sooner rather than later. Yeah, because that's what we have been pushing for.
Yep.
Yeah.
And for me, it's great that we have the report, but now that we have the report, we gotta get busy. I mean, I'm disturbed to hear that it falls on a position of the chief, well, and maybe now in the Office of Equal Opportunity based on what you just shared. And those individuals are, and I'm talking about the OEO office now, which is limited with its resources already.
But I think it states that it had formerly been part of the EEO office and was given to the chief equity officer, but that was taken back and went back under the administration of the mayor's office.
So somewhere it's some staff member.
And so they were going to appoint, the mayor's going to appoint a liaison, but he didn't name the liaison that he was to appoint.
Sure seems like a job duty of the chief equity officer, but
He took that from him.
So I would say moving forward, I think that maybe we can ask for reports on what they're doing. I don't know if we can do that, but I think it would be great to just, start poking, hey, what are you doing about this? And see if they can start, whoever responsibility this is, this liaison, maybe they can implement all the recommendations that are in there and us to see, hey, have you done this, basically? Yeah.
Would the committee oh, sorry, there's a hand up. Issa, go ahead.
I think similarly, I was going to say, if we could find out who this person is in the administration, can we invite them to a meeting in 3 months and let them know that we'd like to ask them questions, or we'd like them to give us an update on what they've done that addresses the flaws in the report? I mean, the report basically says there's policies, nobody's following them. I mean, the report basically acknowledges that the policies are there, but everybody's ignoring them, or they're not trained on them, or they're just not being utilized. And so if there is a person, can we find out who that person is, and can we invite them in like 3 months and find out what the plan of action is? And we can ask these questions directly. I think Mayor's got a great question. Does this include the police department? Does it not? Like, what was really looked at, and see if we can get down to some, hold them accountable. Hold them accountable to come and try to answer to us what they are doing now that we have it. I don't want to say I was dismayed when I read it. I think I read what exactly I thought was happening in practice, but the worst thing we can do now is know it doesn't work, acknowledge it doesn't work, and then ignore it. And so I want to, if we can hold them accountable in some way to have to come here and tell us, we know and we're still doing nothing, then at least they're publicly saying that.
Is there any objection to following up with, as Issa suggested, finding out who the liaison is and inviting them to come 3 months from now?
I would love that.
Okay. Does the committee want to appoint a subcommittee to work on this? Or do we think that's not needed?
I think we should wait and hear in 3 months and see from there.
Okay.
That's my rec.
Does that, other people agree? Okay, anything else on this topic?
did the report actually provide some remedies or no?
There were some recommendations.
It's recommendations for every topic that they
Mm.
want.
But I do think it would be worth maybe not creating a subcommittee, but gathering questions.
In addition to the two that we have?
Oh, no, if you're collecting those, that's great.
Yeah,
Sorry,
I think
didn't
we can,
realize.
we can find
Okay.
out who the liaison is and follow, and
And then
follow up on
ask
those.
specifically about departmental
Yep,
implementation, including and especially APD.
yep.
Great, thank you. Sorry about that.
Yeah, it's okay. Anything else?
Do that when they bring them in, when we bring them in.
Can we keep it under old business so we touch on it at the next meeting in case we want to get our questions and make sure we find out what the response is? Thank you.
Great idea.
Oh, I guess I was thinking once we find out who the liaison is, then we could invite them to the meeting. And I think Issa was saying in about 3 months or whatever, and then ask our questions or what have you.
I think we could ask them the question about APD as soon as we find out who it is. We can just email them. Okay, oh, go ahead. Anything else on that topic?
Through the chairs, I emailed Member Rivera and he said he will find out and let the committee know
Oh, great, perfect. Both those questions?
who the liaison is.
Okay. Great, thank you, Jasmine. All right, let's go on to our next topic. Are there any new member nominations?
I want to nominate Carmen Paredes. She's joining us today, but if she can be a part of the committee.
Great, do you want to give us any background or thoughts? Anything to share?
Yeah, so and Enlaces finally got our director of programs. Her name is Carmen Paredes. She has a rich background on corporate here in Anchorage, but she comes with a lot of fuerza, and we're very happy to have her. And she will be managing all our programs. We don't have very many hours, but it's a really good start for us. So I want her to be part of this committee as part of Enlaces and the Latino Hispanic community here.
Director of Programs.
Are there any objections to Carmen joining? Okay, hearing none. Welcome, Carmen. Great. Any other new member nominations?
Paredes, P-E-R-E-D-E-S. Paredes, P-A-R.
That's correct. Yes, Paredes.
Thank you.
Great.
Mhm.
Okay, welcome. All right, let's go to committee member updates. I know a lot of stuff's been happening. It's a busy time of year, so maybe we can just go around the room. Celeste, do you want to start us off?
So the Alaska Black Caucus has been really busy. We just finished up the Betty Davis African American Summit, Marching Till Equity, Equality, and Justice is One, and moved quickly. Well, that was after we moved from the MLK event, but we are working on a couple of grants right now. And so Healthy and Equitable Communities is one, and Breakthrough is our other one, where we're going to be focused on domestic violence. The Equity Center just got a new contract and it's being reviewed by our legal team. And so we're hoping to get the Equity Center renovated and open for business by the end of the summer. And let's see, and the list goes on and on. So glad to be here. Thanks.
Thanks, Celeste. Mara, do you want to share any updates?
Yeah, sorry, I can't ever find the mic on this. I just want to let people know that in April, I'm going to be heading to Dallas and hopefully Felix will be joining for the Welcoming America Interactive. So I will connect with Felix beforehand to see if there's things that we can coordinate when we're both down there in our different roles. And then my organization, the ACLU, continues to persist in its effort to ensure inclusion and equity, especially for the trans community. We filed 2 lawsuits against the state One about removing books from shelves to protect First Amendment rights. And then the second about a bathroom ban in the Matsu Valley. So we are continuing to monitor equity and equality issues for the queer and trans community, and also continuing to monitor other essential rights like the right to free speech and assembly. So we're keeping very busy. The other thing I just wanted to mention, because I haven't seen it reported in the paper at all, but APD just confirmed for me last week that there were 52 outdoor deaths in 2023. And so I wanted to surface that very horrifying piece of information for us here in Anchorage.
Wow. Thanks, Mara, for sharing that.
Mara, how does that compare to previous years? Is it a significant?
Well over twice.
Yeah. That's it. Like a doubling to me. Yeah.
One for every week. One person died every week of last year. I mean, not technically, but.
Right.
Yeah. And the other thing is just, again, I know it's not Anchorage focused, but Issa is reminding, seeing Issa's face is reminding me also too of just remaining vigilant about what our state does on our southern border. And the horrors that are happening there that definitely trickles up to the people who who are our neighbors in our community.
Thanks, Mara. Issa, do you have any updates to share?
Yeah, I'll share it. Sorry I was out. I created this human. He's come to join us, my son. The CSS, the Alaska Office for Refugees that I lead, we are hosting the first ever resettlement conference this year. It's happening in April 24th and 25th. So I'll put some information in the chat, and then also you can just go to cssalaska.org and you can find it under the Alaska Office for Refugees. We just confirmed our keynote speaker, Mayor Wilmot Collins from Helena, Montana. He's the first Black mayor in the history of Montana, and he's a Liberian refugee, arrived to Montana and is now the mayor of Helena. So he'll be coming up to be the keynote, and the Federal Office of Refugee Resettlement and individuals from the State Department, from PRM will be joining us, and really centering a lot of refugee voices talking about their experiences coming to Alaska and workshops and other things. So check it out. There's early bird pricing through March 15th of $125 for 2 days. So hopefully some of you will be able to join us and learn a little bit more as the state of Alaska has received about 250% increase in refugee arrivals, and really statewide. I know this is Anchorage based, but I'm traveling to Juneau, for example, next week because Juneau's a rising group of arrivals in Juneau, Haitians, as Mara references the southern border. So it's happening here. So if you are interested, please come and attend the resettlement conference. Thanks.
Thanks, Issa. Yeah, so if you can share that information with Jasmine, then she'll make sure it gets on the calendar.
Sounds good.
Committee. Joan, do you want to share any updates?
Yeah, so Enlaces is doing, fingers crossed that it's April 27th, we're doing El Día del Niño event, and we're going to have vaccinations for kids. We're going to have different vendors, bouncy house, and hopefully we're going to find out tomorrow, we are going to join forces with, so we're going to do it at this elementary school, Government Hill. Gracias. Elementary school, and they're doing their multicultural event that day as well. And last year it was very successful. So they're expecting around 1,000 people. So joining events that will hopefully we're going to be able to vaccinate a lot of kiddos in there. So that will be April 27th if everything goes well.
What was the name of the event? Kids Day?
Día del Niño. Kid
Day of the
kids. Yeah.
Dia del Niño.
And I believe that's all we have as of the moment. Thank you.
Is that vaccinations in general or specific? Yeah, I know for kids, but specific type or? Right, that's what I was, trying to find out if it was that type of vaccination event or if it was something that's delayed COVID related or something like that. Yeah, okay. Right, gotcha.
Heather, any updates? I'll just say we're getting ready for spring sports, which this year the middle school and high school sports all start on the same day, which is lovely. But I think in general, the district does better than the municipality in terms of providing services to non-English speakers, but it's definitely a barrier that there's an online, at the high school level, an online sports registration piece. And so where we're happy to be out there in the community providing physicals to these students, it doesn't always translate to them getting to be on like the soccer team, for example. So and I know like the Reyes team does a great job supporting these families too, but that really is the biggest limitation, I think, to getting kids involved. So if you know any out there that need more support, we can do our best to try to help them, or it's kind of like a one-on-one situation, but yeah.
Is there are there any fees associated with the physicals or anything like that?
We bill insurance, but we can waive fees because we did get a grant from the municipality that really helps us. So, yeah.
Heather, has there ever been discussion just about getting rid of the requirement to do a physical for sports? To me, it seems like one of those things that probably when it started, maybe there was a good reason for it, but now it just seems like a barrier. Like, do you
Yeah,
catch things?
I mean, I'm not,
often
yeah,
that-
it was funny because we did 10 kids at West today and the principal said, did they all pass? And I was like, yeah, but yesterday when we were at Romig, there was a girl who had a murmur and she hadn't heard of the murmur, or we haven't gotten a hold of her mom to know about this murmur. And I think, it's a small percentage of kids, but like some of the more public, like LeBron James's son had a cardiac event. The guy in the football, the Buffalo Bills player that had one, so that stuff is out there, but it's rare. I know sometimes they catch like hernias in boys and things like that. So it really, I mean, we're catching some things like depression and anxiety that or kids are disclosing because we have like a risk screening tool, and kids are disclosing things to us that haven't been disclosed before. So we've done a lot more this year, child abuse reporting. So it's not necessarily like this like physical stuff, but yeah, some of these kids haven't been to doctors in years. So
that's good.
mhm. Yeah. Pastor May, any updates?
I'm good.
I don't think I have any updates.
I'll give a couple.
Okay, Lori.
I have a couple things I'll just mention. One is last week I attended the National Digital Inclusion Alliance Conference in Philadelphia. And it's a really heartbreaking the impact that losing the affordability connectivity program is going to have. There's 23,000 plus families in Alaska, more than 13,000 households, and we know that many of those households are doubled up families that are receiving their internet through this program. The internet will be turned off for them. These are families that we have enrolled hundreds of families through Alaska Literacy Program. I know personally ISSA, it's one of the things that happens for new arrivals. It is how people are taking their English classes. We've never had such robust online classes, and they will all be losing their capacity to take online classes. And I don't know what the impact is around people who attend school, but we have moved everything online and we are not providing access to life. My biggest concern has been alleviated by my conversations. People cannot go into collections because they don't understand. They can't just start to be automatically billed if they started with internet on this program. But for a family who started with internet and then needed to access this program, but they were paying independently first, could potentially not be cut off. And we're trying to figure out, from GCI and ACS, but even the communications that we're getting from the telecommunication companies. When I call those numbers, it's inaccurate information. People don't know why I'm calling that phone number. They're suggesting another program like Lifeline, which is a telephone. So the communications are chaotic, confusing, inaccurate. It's hard for us to help share with the community information. The school district seemed surprised when I reached out. Thanks, Heather, you shared last time. But lots of families are accessing, and that's how you connect to Parent Connect or whatever it is called. So that's how you're expected to communicate with your teachers and check on your students. That's all going to be denied. So it was a little bit heartbreaking, and there's no indication that they're going to pull through for us at the last minute and continue that program. So it will be winding down in April. The other thing I'd like to share is ALP had a very particular interesting experience because we were shut down because of the roof situation, and it was mass chaos. We spent weeks and weeks trying to get our roof shoveled, and we got a do not occupy letter, and we had to close down for a full week while we worked to make sure our building was safe and remove the snow. And it costs I think the final bills are going to come in, but it was probably around $10,000 for us to get the roof shoveled, the inspector in, and the snow removed. And I know that that's a cost that many nonprofits can't afford, but also many people are at risk with their housing when those go out. Okay, thank you.
Lori, do you own or rent?
It is such a mess. We own 11/16 of the building. They're individual office condos, and it's an absolute nightmare for me I spend probably 1/3 of my entire working time just caring for our falling apart building. Personally, doing work that I shouldn't be doing, and also writing grants and working with, trying to figure that stuff out. I'd like to not be doing that.
Had a question for you. Are the various ESL programs throughout the city directly related in any shape, form, or fashion to ALP?
So we are the regional provider. There are a couple other places, like ISA offers programming that I think looks a lot providing support and services, but she's not running an education program out of there. There are certain churches that offer like citizenship classes on their own. Sometimes they reach out to us for free technical assistance, and we do what we can. 9 Star offers a certain amount of service. I know that other places are interested in offering forms of adult education, but we don't really have anywhere else that we really can refer to. It's a very underfunded, and there's a huge gap when it comes to adult education in the city. Issa, do you know of any others that you refer to that are out there?
No, I mean, we refer to 9 Star and to you, and that's it. And I just wanted to note that also the concern around the connectivity program, think about all those snow days and kids were supposed to be learning remotely. I mean, granted they're not doing the most in those remote learning days, but our students are going to have no access at all to remote learning days. And so if we're going to live in a city that struggles to plow the streets and schools are going to be closed, this is really problematic. Those kids are going to fall behind. It's an equity issue, certainly. And during COVID, people were hooked up with internet and other resources to be able to do that, but they're not going to do that for every kid in the entire district who doesn't have internet in their home. And so we're concerned about our families who are already confused enough by a remote learning day. And then to have a remote learning day you can't even access at no fault of your own. So the district needs to think about how they're going to do this, because you can't have remote learning days when people can't attend.
Sounds like a potential ACLU lawsuit about free and appropriate education, maybe a little FAPE there. Thanks, Mara.
Well, I just want to add, as someone who has 2 kids in school, it's not just remote learning. Everything requires they submit their assignments online. Like, it all happens through the Chromebook. So it's not just remote learning, it's every day.
It's all the scholarships. It's applying for college. It's applying for anything after high school. It's everything.
This is a good segue to Asher, who is a teacher. Any updates or anything you want to share?
No updates.
You want to weigh in on the remote learning?
Oh,
No, home internet?
no, I think it's, the issues that were brought up, they're legit issues. If teacher by teacher, it's a different story. But if you're going to make assignments count towards your final grade and people don't have access to it, it's, yeah, certainly it's fair and equal opportunity. It's not.
Okay, any other updates you want to share? Didn't get to, John?
I really quickly, I want to share, and this has nothing to do with unlasses, but AARP is already doing the free taxes around the municipality. So you can find the schedule on their website, I believe. And yeah, pretty good service for free for our community. And I know AOP has them at their building, I believe.
Yes, and if anybody needs an appointment, they just call 211. And if they're interested in being a space that's well-trained in language access, that's AOP's space.
Perfect. Thank you.
Great, awesome service. Okay, I don't think we have anyone from the assembly on, correct?
Yeah, sorry for not making that clear.
Okay, we can slide through that item. Okay, our main topic today is to review the results of our work session that we had at the end of January. And it's a really good session. We had good food and we got out exactly at 2:00. It was masterfully run by Pastor May. And then Heather, thank you, Heather, put out a poll to everybody because we came up with, you know, as always, a long list of things that we want to work on. We also had a good discussion about the need to prioritize, and not just to prioritize, but also to communicate with the mayor's office and with the assembly about what our priorities are. We had some reflection about the first year of our committee work. There was a lot of things that we ended up kind of reacting to and responding to. Assembly members brought us lots of different kinds of resolutions to review. And so we were a little bit all over the place. I mean, we had kind of our 3 big buckets that we had identified the previous year, but that didn't necessarily put many limitations around our work. So we had some conversation about the importance of us being more clear about what we want to prioritize over the course of the year. And so then Heather put together a poll that everyone was able to respond to. There were a couple of things that we didn't include on the poll. One of them was that we really want to have a meeting with the mayor and with the chief equity officer once we have a game plan for the year to talk about that and to find out kind of what sort of support they're able to offer. Because one thing that Felix mentioned was just that almost every committee has someone in the administration that's helping move the work of the committee along. And because we're all volunteers, that's pretty necessary if we're going to make progress. So finding out what resources we can get from the mayor's office will be one thing we'll for sure do. And then as we get into the results, I'll hand it off to Heather to talk about that in just a second. Again, if we're going to be working specifically with a department or a certain area, we'll need to also talk with them, obviously, and think about how we want to work together. Pastor, anything you want to add?
I was going to piggyback on the commentary about the chief equity officer. You know, and I think it's good to see how that office and the mayor's office can provide us some teeth and some structure and help us get our agenda moving along, but also to see what the mayor's going to do about his job description for the chief equity officer in regard to what the assembly has enacted as well. So for me, it's a two-pronged thing. Yeah.
Anyone else want to add anything just about the work session and our discussion? Okay, Heather, over to you to share the results.
Yeah, so I, set it up so I would weight each of the categories, but when you look at the graph on the Google spreadsheet, it was like single story house, skyscraper, single story house. And so it just, was a clear winner, if you will, on what the priority should be for the next year, which is analyze Anchorage Health Department budget and allocations within the department to make strong recommendations to effectively leverage our resources to build health equity. So, yeah, but and then the other, I don't want to say they were totally even, but some of them were weighted slightly higher, but nothing within range of the first ranking one. Now
So
we
this-
just need to figure out how to do it.
Yeah, so this isn't like a binding vote, you know, this was meant to kind of be an opportunity for the whole committee to weigh in. And how many people did you get total responding, Heather?
There were 9, primarily the people that participated in the Saturday work session. Yeah, I'm just,
So tell us a little bit more about how you weighted them then.
so like if somebody ranked something first, then that was like 3 points. And if somebody ranked something as their second priority, then it was 2 points, and their third priority was 1 point. And so it was just, and
Everyone had 3 votes?
correct, yeah. But you know, so 9 people did the survey, but 8 of them put that as their first priority. So that made it weigh in stronger. And the one person who their other first priority was complete an analysis of the procurement policies to identify areas to increase equity in granting, hiring, and contracting. And then all the other ones were second and third. Yeah, and a couple zeros. So. And then, yeah, the comments, somebody only weighted the first one. And then that, you know, we need to work more with the administration to identify the role of the chief equity officer, implementing the agenda. And then somebody said it was hard to make choices, which is true. But sometimes you have to do that.
Okay, so let's have some discussion on this because again, it's not like it's not a binding vote, it's a pulse check. So especially for those who maybe weren't at the session or any thoughts on identifying this number 1 as our priority for the year? And then also a question, you know, last year we kind of had 3 big priorities, which again, didn't really help us narrow down too much. But I guess we don't necessarily need to overreact and only have 1 priority. So is there perhaps 2 that people want us to kind of prioritize for the year, or what are your thoughts?
I have a question. So I'm very interested in number 1, as most of us. My question is like, how can we do this? How can we actually do the work? And how will the Anchorage Health Department be open to our suggestions or our, hey, what are you doing? How can we help, etc.? Like, how can we do the work?
Yeah, and I was just gonna say that in that regard, you know, can this get broken down into subcategories of like tangible tasks?
I was just gonna say, it might be an interesting question for them to say, hey, where are you struggling to, you know, get input from the community and from different, you know, parts of the community? It'd be interesting what they have to say if they could point us in the right direction as well.
It also might come off better to be from the perspective of how can this committee support you versus like, we're here to be critical of the work you're doing.
Yeah. I mean, I think one thing to think about is the health department has a lot of things within it. So it has the childcare office, SNAP and WIC are part of it. There's the Aging and Disability Resource Center is in there. The homelessness coordinator is there. They have a clinic, so their public health clinic is there. They do a lot of
Capital grants for the CDBG.
Yep. So they do some capital grant funding. They would do a lot of grant funding. That's where the alcohol tax funding comes out through, as well as
Marijuana.
other marijuana. I don't know about the marijuana tax money.
Well, that's part of the childcare one, but the A-tax is through, the alcohol is through the health department.
Yeah, but I don't know
Um,
about the marijuana one yet.
Okay, cool.
Have they put some of that out yet?
No, because they're still deciding, but I think it's,
I've heard them talk about, I mean, like it's coming out of the health department.
It seems like it would. I
Mhm.
mean, yeah. So there's a lot going on there. Is there any, I mean, I think in the one hand, all of those things fit together very well. On the other, are there pieces of that the committee's particularly interested in?
Well, I'm just looking at like the third priority, which was somebody's first priority, to look at procurement and
Mhm.
policies, and maybe that could be applied specifically to the health department first.
Mm.
That, you know, kind of a more
Mhm.
tangible task within the bigger part of it. And then that could potentially spread to the other departments depending on how we move forward with it.
Mhm.
You know, for me, I'm thinking about the city's affirmative action plan that they talked about so much. Seems like that plan would have a lot of this information in there from the various departments. It should be answering a lot of these questions. And I'd be interested to know, because that plan it used to be in the Office of Equal Opportunity. Now Employee Relations is responsible for the affirmative action plan. I'd like to invite the ER director to a meeting to talk about that plan.
And is there a current plan?
There should be,
Yep.
because they receive federal dollars.
Yep. Now that we've looked at a previous one, but current one looks like, yeah.
PO director, is who you wanted to invite? Do we-
The employee relations
Okay.
director. That's me.
No, I was simply going to say relative to whether or not the committee chooses to go with this one as the major focal point of emphasis, and if not any of the others or what have you, then I think for me a good starting point would be to, if we're going to analyze the budget and the allocations and that kind of thing, a good starting point for me would be to get a copy of the budget, which would entail all of the departments that you were naming and everything else in it, and maybe explain why we want the budget, so we won't again come across as combative or what have you, why we want to look into it and analyze it and see where we can get in, where we fit in.
Mm-hmm. And I'm pretty sure, I know that we got, I'm sure the budget's on the website, although I don't know how much detail, because I remember when we looked at it before. I don't know, well, there must be a more detailed version somewhere. I know when Anna presented to us, it was pretty high level for the departments, I think, but, so that's a good question. So it sounds like there's kind of two possible routes with this. One is kind of about how they do their work. So the procurement, you know, how are they allocating their budget? The other one is maybe more about like the impact of all the programs that are within it and how they're organized. And I think there's some good, so maybe one of the things we need to do is kind of come up with some good questions, like with WIC and SNAP, for example, like what proportion of the families who are eligible are actually getting that service through the municipality? Like, are there barriers with the application process to them? Like, are there language barriers? Like those kinds of
Well,
questions.
they've added a lot of barriers on, in addition to the federal ones that make this particularly particularly difficult to access. I know for a fact they have room to have more people on WIC than they have on WIC,
Mhm,
because there's a lot involved in that.
mhm.
And in Anchorage, there's a shortage of foods at the supermarkets that qualify for WIC. So like you can't just buy eggs. You can only buy the WIC approved eggs, and they often are gone when you go to the grocery store. The WIC cheese, the WIC milk, the WIC eggs aren't even on the shelves. So there's, you know, there's a lot that goes on with that. And also for me too, just thinking about the programs they do have and looking at them, but like we are in a statewide crisis with SNAP renewal and Medicaid renewal, and the Anchorage Health Department is who I would think would be in capacity to take the lead instead of all the nonprofits struggling and trying to form our own little groups to figure out what's going on. They should be our huge advocate with the legislature, and I would like to refer legislative aides to the health department and say they're the expert on this. I only know what I know, you know, it's. And that would be, I mean, what health departments do in other cities that we studied and learned is really, there's a lot more going on, and we have the capacity to be amazing if we want to be.
Mhm. It sounds like one of our first things we need to do would be to put some kind of questions or some kind of framework together that we could then share with them. Like, we need to kind of put some thought into this, it sounds like. Does the committee want to have a kind of subcommittee that would work on this? And I'd be happy to work on this.
Would we want,
Something I'm interested in.
if we all selected it as our priority, I think there's at least 8 of us who want to be on the suit. We put it as our number 1.
That would have been my commentary. We first need to select it if we're gonna do that as one of our priorities.
Right, good point,
Yeah.
good point. Thank you, Pastor May. That's getting ahead of ourselves. Okay, let's go, let's stick with that then. So does this group, and I know that we don't have everybody here today, but want to move forward with like working with the health department as our priority this year?
I say yes.
I say yes, but I also think that some of the priorities from the previous year, specifically I'm thinking of homelessness, or I can't remember how it's worded, but that would fall under this umbrella too, potentially.
Yeah, yeah, it does.
So I have a question. Are we going to get anywhere working directly with the health department? Do they even have a director yet?
Well, Kim Rash is acting.
They're really busy, and I just think that the buck stops with the head, which is the mayor. And then I have some other thoughts, but I won't put those on blast. They're not good.
I can say that I agree with you, Celeste, that like working with the health department probably won't get us what we want, but if we analyze it and we look at it and then we know what we want to really recommend the mayor and the assembly do in order to help bring the health department to the one that would be the one that we want for our community, they're not in a position to like say, hey, we should do all these things, right? It has to be the funds have to be appropriated and the administration has to be supportive. So we don't want to set it up for failure, right?
Yeah, I mean, I guess I had an experience last summer where I worked with the Complex Behavioral Health Task Force that was one of the 2 task forces that came out of when the assembly shut down the Sullivan. And we worked for about 3 months. It's a pretty good group. We got a pretty good plan together, and then we kind of prioritized 3 different objectives in the plan and presented those. And that was, I think, in September. Between then and now, one of those priorities ended up on their legislative priorities list. And then the other one, they just put out an RFP to fund it. So, I mean, it was kind of interesting experience where when we got together and put this kind of plan together and identified these objectives, they actually did. There was movement on them. So I wonder if what we're maybe considering doing is, I think what you were just saying, Lori, which is like almost proposing a plan or a set of priorities or a set of like a health equity plan, kind of. Is that what we're maybe doing for the department? Like, this is what we think you should do.
My thinking on that is, and I'll just be, forthright with it, and that is this. I'm trying to be sensitive in my head and in my heart to the non-combative discourse that overrides all of this versus the reality of if we're going to analyze and if we're going to recommend anywhere we get involved in the process because somebody's already running it, is going to be perceived in none too healthy, whatever, you know. And so if ours is actually about equity, and if we could find inroads and say, hey, have a meeting of the minds and that kind of thing, that helps. But many times we're going to be talking about stuff and recommending stuff that's going to go counter to what's actually taking place. And so that's, you know, I mean, it's sort of a Nike thing, you know, just do it,
Mhm.
kind of.
Mhm.
I'm very curious about their procurement. I don't know if I'm pronouncing the word correctly, but
Good job.
on I with the state, I do work with the health department, and the Healthy and Equitables grant was sitting for over a year. And nothing happened because of there was no people. However, when we started pushing them a little bit, and I do work with Kim, apparently they did some updates to procurement, new protocols, and we were talking since October of last year for this grant to move forward, and the assembly just passed it this year. I mean, this week. And she was talking a lot about procurement, and so I'm very curious, like what's going on in there for them to hold this. I mean, this is over $1 million. Like, why is it so hard to go out the door if the funds are there? What are they doing? So that's and my other thing, and I talked about it in our session, was about how they do their grants. In my opinion, the health and equity grant was very hard for some agencies. It should have been a little bit simpler, you know. So I don't understand why there are so that bureaucracy around all that, and why funds cannot just, you know, move a little bit easier. Just very curious.
Yeah, believe me, we really know
Yeah.
about that.
We're all just shaking our head
yeah.
like, yeah.
I mean, I think what I could see us doing is kind of what we're doing right now, which is like, what recommendations would we make for each of these areas within the department? Like with the procurement, I feel like we were just talking about this. There is a whole like body of research in philanthropy about how to fund in a way that promotes equity, and it simplifies things. It employs more trust. It doesn't micromanage. I mean, all the things, right? And that's research that we could find and bring.
Or talking to the head of the department and the assembly, there's something in the middle that is not working.
Yeah.
You know, so I wonder how can we ask, like, hey, how can we help, or what is going on for this to be easier? And I bet it's not just the grants. I mean, I saw it on our end with the Health and Equitables grant, you know, and at the state, we were just pushing, and it was just stuck there.
Oh, within the municipal, so at the state, you were pushing them out.
Yeah.
But so it would get stuck right at the city?
Yeah, so I work at the Healthy and Equitables Communities Unit at the state level, and the fundings were there, and it was stuck. It was stuck in there.
It's still stuck. I mean,
Well,
I
they
just
passed
had
it
yeah.
on Tuesday.
It's okay. Okay, so my issue is maybe I didn't explain it properly for it to be comprehended or understandable for some. I've been in this work for a long time, and we have been at the table trying to make change. And if you don't have the folks at the top, this is just how I see it. If you don't have them at the top understanding why this has to happen, it's not going to happen. It's going to get it's not going to move. And so we can do this and make these recommendations and write up the report and all these good things. But what is it gonna get us at the end of the day? And maybe some of y'all are new and got all this energy and stuff, but I'm just thinking, if we're gonna do something, let's make it something that's gonna be effective.
My thought on that is if you have state appropriation and you get to the municipality level and it's not being pushed out for whatever reason, a good starting point is, okay, share your process with us. Once it's been approved and you have it, what's your process for getting it out? And then how can we streamline that?
The mayor is over the municipality. I mean, everybody works for him. Oh. And they work for
Director
the
works for
mayor.
the mayor. Yeah.
I can share that we've had a grant for 9 years that should have taken 1 year, that we are held hostage as an agency by a very particular grant. It doesn't matter who the director of the health department is, who the mayor is, who's on the assembly. There is something broken within their grant process on how they support agencies and how they move money. And it would be amazing if we could get that cleared up. I mean, our whole agency is at risk of being shut down because we cannot finish or satisfy grant requirements that we have been held to for more than 9 years for something that should have taken 1 year. And it has taken years from my life.
So seeing that, those types of things are major issues, that may be a good point to start and see what the process is, why is it like it is, and what can we help to recommend to shift the process and move it along. And if we can get some buy-in from the health department side, then maybe we can see some of this stuff start moving from the inside. And relative to, I think what Celeste was alluding to is if you got a problem with the director who's over the department and stuff is not flowing like it ought to flow, then the one who appoints the director ought to be able to say, get it flowing. And I guess that's kind of where she was coming.
Well, I just remember back in the good old days when we had, administration that was supportive of the work and the community. You could talk with the mayor if there was an issue or whatever, and it would funnel down and it would get resolved. And so that's why I say the buck stops at the top.
In addition to the mayor and the directors, there's also within the health department, there's 5 commissions, 4 of which are relevant to us. The Animal Control Advisory Board, probably not a priority. But Health and Human Services, Housing and Homelessness, Senior Citizens, and Anchorage Women's Commission. And so I don't know if any of those commissions, if it would be worth interfacing with them to learn more about, what they're doing to advocate for some of these issues and promoting equity. It just could be a starting point. I don't know.
I think the other thing, just remember that we're an assembly committee. So if we do a plan or come up with recommendations, then that really is going to the assembly too. So, I mean, I could see coming up with a set of recommendations that says, there are this many families in Anchorage with children under the age of 5 in, a low income category, and we're only funding childcare for, 15% of them. We need to allocate enough funding to, you know what I'm saying? It's like, I feel like we could come up with some recommendations that also could just go to the assembly around how to appropriate, because in our charter, like that is kind of our scope of work, is really advising on budgetary matters, and we haven't really gotten into that too much yet, but I feel like there's a lot of potential there.
I get the sense that Mara wants to say something. I see her facial expression and she knows how the administration, I mean, if I remember Diversity Month, I mean, there's all kind of programs when you have at the top support, and I just don't see the support for equity. I just don't. Maybe I'm missing something, but.
Celeste, I think that was my face. Damn, you can see me pretty well. Yeah, I think the question is the commitment to equity and all the concepts that go with it, including inclusion and access. And, even in the language access audit, I think it underscores that. And so maybe it's just what I've been thinking a lot about is, and I hear you, Thea, I think that's really true, just to understand the role of this commission. And at the same time, we're a group of organizations that can use this time together to come together and brainstorm, because I think one thing that all of these cycles of leadership have demonstrated for those of us who have been in this field for many, many years is that we need to come together and hold governments accountable when they're not. And it's up to us. And so recognize it, yes, we're all volunteer. I think it's okay to request staff support. I think we need to request staff support. And then we need to just continually remind ourselves that our role is to hold government accountable as a citizens advisory commission, basically who we are and what our ultimate purpose here is, and recognizing that we're lacking leadership at the top for equity. And so in the meanwhile, we really need to express and connect with each other to make sure that we can keep tracking all of these variables.
Thanks, Mara. So let's go back to our original question. Do we have consensus that we want to focus on the health department? I guess I'm hearing a few different things. One is analyzing the budget. One is analyzing the programs, maybe making some recommendations for each program in terms of health equity.
I think all of those are one and the same. We just having various inflection points relative to that one.
Yep.
Yeah.
I pulled up the budget online, and it's interesting because it also has priorities within the department or performance measures. And I think reviewing those could be relevant to this discussion of like, where are they putting energy now, and then, what's their progress on that?
Are any of the ones you're seeing like relevant to health equity?
I haven't gotten that far.
Okay.
Again, it's like, health food and, food inspection, childcare licensing response time, things like that. So I'm just doing a quick skim.
I mean, when I
But they
listen,
might be.
because the Health and Health Policy Committee, HD always gives a report every month, but the report is entirely process. Like, how many inspections did we do? How many? It's just all very short-term measures of work, not really of outcomes. So that's one thing I always think about when they're reporting is like, yeah, there's work going on, but like, what's it doing,
So,
Are there other priorities that people would like to bring forward for the committee for the year in addition to this one?
Sorry, can I just add, and I apologize, I wasn't able to be at the the meeting where, excuse me, where these priorities were generated, but I also think it would be easy enough to wrap in the language access piece into the health department.
Yes.
And given our earlier conversation, it feels like that's a priority for us too.
Yeah. Yeah. That seems key.
Number 3 was a big one for me.
Procurement policies. Yep.
As it relates to identifying areas for increased equity in granting, hiring, and contracting.
Mhm.
Yeah, and then there were a couple that could have compacted in that far as I was concerned about it, but that one was
Yeah.
one that I think deserves a little emphasis.
And so this kind of brings us back to the change lab analysis, because that's what they were originally potentially going to be able to do. What do you think about seeing if we can get their help, but to direct it at the health department? I mean, the health department does a lot of procurement and grants and contracts. And there's a lot of issues with them, as we've just heard. What do you think of that, Pastor May?
I think we, if the health department is our major one, then it's going to consume most of our time. But as you relate, there's procurement in that department as well, granting, hiring, contracting, and the whole 9 yards. But it goes to, I guess, when you look at all of these kind of play in, when you look at the diversity questions throughout the entire administration and municipality and all of that plays into number 3, it plays into number 1, it plays into all of this. And so it speaks to equity. How equitable are we being with all of these diverse cultures, this melting pot that we know is how equitable are we being across the board? And regardless, my thing is, regardless to what we choose, that's the thing that we can't not lose sight of. The diversity question and the equitable question across all of the gamut of our diversity, and who all are being equally and equitably benefited by everything the municipality has to offer. It's kind of, I think that's kind of why we exist. And Mr. Legal Person, how would you even define the term liaison?
Well, it depends. No, I'm sure there's a better definition out there, but the term liaison is generally used to describe someone whose job is to be a conduit for information, and to facilitate cooperation between two bodies. So it's not necessarily a position where somebody has decision-making authority, but instead they're there to be a representative for one agency with another agency in another agency and vice versa.
Thank you, sir. That's kind of my thought process on it as well. And yeah, I think that's a good point for us to keep in mind relative to the liaison question in general. Whether it's language access or whether it's this committee.
Yeah.
Yeah. Or to me, it seems like we've got a couple of different directions. One is programs that are already in place that it can be accessed directly by the people, right? I feel like that's where, if we knew what some of these programs were, part of what we bring is coming from a lot of different communities that we can, bring awareness to programs, especially with, language access stuff. The other would be new programs that aren't yet there, which would be a totally different route. So we have those things going on. But I feel like if we understood, hey, here are some programs out there that can be directly accessed by community members, but groups from certain communities for whatever equitable reasons, don't have the same access, then spreading information, is one way to go. I don't know. I think it's hard because I don't know what those programs are right now, but that's part of the power I think that this group has. Like, we aren't assembly members, but we have access to a whole bunch of different groups that we can help spread information. And that's the kind of stuff that can be measured So I think it'd be interesting. That's how I see the couple different directions, we can go. But again, what programs are there to begin with that we can help either augment or spread the word? Yeah, but I also think that the language access is one that we shouldn't overlook. That could be a major component of what we're doing, because so much of the communities that I think don't get an equal say has to do with language.
Yeah, just for example, like not providing language access to help people become a licensed childcare facility is directly impacting the amount of childcare facilities we have right now that we're in desperate need of. And ISSA has led the charge on that for years. And so has Navoin from my office been really active in trying to figure out what's wrong with the system there, that we cannot make it accessible to more people when it's it's a huge crisis. So they all kind of tie together.
But I think
Yeah,
that's
great.
where, like, anecdotally, we could say to the assembly, okay, this is a problem, but I think we need to look at it more in depth to then make recommendations of like, that the assembly can then tell the department, these are changes that need to be made. And I know we talked about this a little bit in January. Now we're at the end of February, and by our next meeting, our mailboxes will have our ballots for the election. By April, potentially a mayor or runoff ballots. And so, we can't just wait around for changes, but, we have to consider that we're either going to be going down the same path for 3 more years, or that it might be a change that, and how would we want to, if there is a change when that's identified, being involved with potentially a new administration.
Even before you spoke about that, I was thinking about, well, wonder if we focused on making sure communities were registered to vote and voting, and put all our efforts to get out the vote. Not saying who to vote for, but to really make an impact in all of these diverse communities by making sure folks were registered and voting.
I heard something recently on the radio, and they were asking this question: is voting and getting people to vote political? And I think that's something that hasn't been answered yet. I like the idea, but do you start running down the the issue of whether it's political or not? I don't see it as political, getting people just to vote. I mean, that's a
We're
democracy.
not endorsing candidates. We're not
Agreed.
saying, but we are, I think it's our duty to make sure our communities are registered and voting.
I agree.
That's where the real power is.
So in terms of just wrapping our conversation up for today, do people feel enough support for the health department project, whatever we decide it to be, to kind of take the next step in kind of defining it? Like, does a small group of people want to come together between now and the next meeting to kind of write up what that would look like? I mean, I think we've brainstormed a lot of good ideas today, but we need to sort of think about it and frame it out a little bit, I think. Are people supportive of that next step, or Celeste, were you proposing this committee?
But no, but
Focus on
I do
voting?
like what Heather shared, though. We're there could be some changes in a couple months.
Yeah.
And what I shared was, I don't want to waste time. I mean, I'll certainly support whatever the group decides, but so.
I mean, just to be clear, like the health department has gone through a lot, like with COVID. I mean, where it was pre-COVID, then we went through COVID, then we had this whole change, and it's completely different now. So there's not like even if everything changed with a new administration, there's not like a normal to go back to. I feel like actually, no matter what happens with the election, if we care about the health department, we have kind of an opportunity to say, here's priorities for this important department, whoever is in charge. starting in July.
I think it's really important. I mean, especially like I see it from a different level. And I wear two hats, one here and one with a nonprofit, right? And there are issues in there that can be solved. And I think this committee has the opportunity to go and see and ask and move pieces or recommend, like, why are you putting all these barriers to organizations? Why? And I think that we are in a place where we can ask and recommend and make things easier for organizations and people. I think that's my opinion. I will be happy to work on that.
If I may.
Yeah, it's just Mara has her hand
Oh,
up.
okay. Good.
Mara, go ahead.
Sorry, Pastor May. Just really quick,
No
I think
problem.
circling back to what I was trying to say before too, I think it's the obligation of this committee or commission to keep the
Any.
goal of promoting equity on the forefront and keep our leaders accountable to that. So what I really like about the idea of focusing on the health department is we can use that as sort of a model maybe and articulate that vision statement that we have for our city to be more equitable, inclusive, and accessible, or whatever it is, which is part of our work. And then I appreciate the work that's been done so far to recognize these pieces and parts, bring them within the health department, and then maybe we do that. Then we can, if we're successful within a whatever period of time we're setting out to do, we can replicate it in other departments, especially frontline departments where there's so much interaction with the community. So I do like this idea because I think that it could potentially be done again if we can get it framed out.
Yeah, no, what I was about to say, my esteemed co-host has been talking around it for quite a bit. And that is nailing down what we're gonna do and accomplish throughout the state. So being a co-host, I'm not gonna make a motion, but I'll make a recommendation that we target number 1 and number 3 for this year, number 1 and number 3, and then all of these others pieces, they all kind of correlate. Most of this stuff does. And wherever those pieces fit in, they can get in with those two. That's a recommendation. So, I mean, we, before our meeting ends, we need to make some decision on what we're actually going to do. And so my recommendation is that we do 1 and 3 and make that an annual thing for this year. And then all the rest of it gets in where it fits in. Somebody can make a motion.
Well, or we can just say, is there any objection to that?
Right.
Because I like
Do
that.
it by consensus.
Yeah.
Can you say what 1 and 3 are?
Here.
1 and 3, analyze Anchorage Health
Oh, or
Department.
just pass that to me. Oh, okay.
There it is.
Number 1's health department. Number 3 is about procurement, granting and contracting. Are there any objections to those being our priorities?
I'll abstain.
An abstention.
Now that I'm looking at it, 2 kind of overlaps with it. It's about, making recommendations of grant requirements and stuff. So there's a lot of
So
similarities.
we're kind of 1, 2, and 3, really.
That's why I
Yeah,
said the others
yeah.
kind of get in. They all fit some kind of way. Yeah.
Okay. We're good to go with that?
Mm-hmm.
All right. What about a smaller group that would be willing to meet between now and our next committee to kind of start? I like how Mara was talking about kind of a framework for this that we could apply to other departments too. Heather?
Yeah.
Joan?
I do my best to be there.
Me? Okay. I think what we've done last time is we've scheduled it for the folks that sort of said they wanted to be there, and then we open it up to everybody. So whoever shows up, shows up. Does that seem good?
So don't forget about when you're not physically gathered, the rule of 3.
I think as long as it's publicly noticed,
Oh.
it's okay. So that's why we would have Jasmine do the invite. What's that?
If it's more than 3 people,
Yeah.
you'd have to record it too.
Okay. So
Yeah.
we'll go through you to schedule it, Jasmine. Okay.
So there's like 3 minutes.
Okay, any audience participation? Okay, any final comments or items?
Yeah, I have a final comment, and it piggybacks on what Ms. Mara was talking about. And whatever we're doing, let's never lose focus,
Mhm.
on the equity inclusion piece across all of these parts and participles of what we're dealing with. I'll say this, and if I can be transparent, when we when we were working as a community health committee during the COVID time and all of that, I think we had power to do various things because we were, I guess, outside of structure and working with structure kind of thing. And I mean, we accepted this model, but I think to a degree we kind of got pigeonholed. And there are so many stipulations and loopholes that you have to jump to get an accomplishment rather than being an outside entity and just dealing with what you need to deal with. So I think that's somewhat restricting, but I also think it's a good place to be, from the inside working, but we can't lose sight of those things that we need to affect. We just have to hammer and hammer and hammer, even though we're working on the inside. And we're labeled the Anchorage Equity Committee of the Assembly. And so because of that, there's so many stipulations and things that we have to do, and then we have to put everything in the hands of the Assembly and even working with administration and all of that. So we can't lose sight of the equity inclusion piece and just have to keep hammering on what we have to hammer on in spite of looking combative. Are y'all feeling me? Now, relative to the piece that we're talking about in number one, even though we have to do this overall thing to look at pieces and pull some things together and out of it and all of that, we've got some stuff on the table that folk have issues with, within the department. And I don't think we should wait until we have all of this stuff together and all of that to start wrestling and grappling with those pieces. If y'all feel what I'm saying. Am I making sense?
Totally.
Well,
Okay.
well, plus the assembly received the audit findings, right? So I'm just wondering, so when did the audit come out? And because to me, like if I were an assembly member and I saw the audit, I would have questions. I mean, I would, and so I'm wondering what has taken, are they, I mean, was there any red flags to the assembly members?
I was hoping to hear today
Yeah,
what their feelings were on it.
and we're gonna keep it on unfinished business for next time when Felix will be here. We don't have an assembly member, but I think Jasmine emailed the questions that we had, so we can take that up at our next meeting for sure. But I think I hear what you're saying. You don't
Yeah,
wanna wait. on
Even with that, they're receiving what we received by way of the report and all of that. But yet and still, we were in here pushing for the report.
Yes, yes.
And it got delayed month after month after month, and then we finally got it, and so.
Worth waiting for.
Yeah, so my point is though, even though the assembly gets it and whatever, we'll see what they do with it, but it doesn't mean we should leave it there.
Exactly.
I guess that's my point.
Yeah.
Real quick, 10 days until voter registration ends. And you can do it online if you have internet access and a driver's license. Otherwise, there's paper forms through the state.
And thank you for all your work.
Oh, yeah.
Yeah, thanks so much, Heather.
Yeah.
Okay, thanks so much, everybody. Really good discussion, and
Thank you.
we'll be in touch to schedule a small group meeting between now and next committee meeting. Okay,
Drive carefully, everybody.
yeah, drive carefully.
It's a mess.